Hello, everybody. It's the 20th episode of Intaction's Circumcision Chronicles Uncut podcast. The horrible, barbaric practice of circumcision is still happening in America, so we're not going to stop talking about it. Today, I'm speaking with Dr. David Snow on Dr. Health Radio out on the West Coast, so tune into our discussion. But first, this podcast is sponsored by Alpha Armor, skincare for circumcised men. If you're cut, or if your significant other is, get the gift of better sensation at alphaarmor.men. Now, here's our conversation.
Program Anthony Lasquadro, expert in the field of circumcision, is joining us. He has an organization called Intaction Incorporated. We'll talk more about that, but we'd like to, right now, welcome him to the Dr. Health Radio microphones this morning. Good morning, Anthony. How the health are you?
David, I'm doing great. Thank you so much for giving me the opportunity to speak to your audience.
Sure. All right. So tell us first, Anthony, how you got involved in such a, sensitive or delicate matter, no pun intended, but the anti-circumcision movement, which is kind of an underground but growing movement in America, apparently.
Yeah, I kind of have an unusual job, and my job is telling people about the benefits of having an intact body and why foreskin is awesome and why cutting it off babies is not so awesome.
No.
I've been conducting this advocacy and giving lectures on this for over 10 years, so I'm very familiar with this subject. But before I get into why I got involved with it, I'd like to ask your listeners something, and that is, I ask people to think, when they see a child or a baby, they have to realize inside of every child is a future adult. And that person wants to start off life with an intact body.
Of course.
They have a life ahead of them full of hopes, dreams, and potential. And just as you or anybody other adult out there would not want to be strapped down and have part of their body removed without their consent, that child has the same hopes and wishes. He doesn't want to be strapped down and have part of his body cut off. And, we're here to try to alleviate suffering in life. We're not here to increase it.
Mm-hmm. But tell us, first of all, Anthony, how circumcision came to be here in the U.S. I mean, obviously it's been done for thousands or, hundreds of, not thousands of years, but before, has it always been here in the U.S., or was there a before and after date when it came into practice here in the United States?
David, circumcision has a bizarre history in the United States. It wasn't really prevalent up until about 100 years ago. And around that time, what was going on is Americans became obsessed with stopping masturbation. And so you have people like John Harvey Kellogg, who is the inventor of Kellogg's cornflakes. He believed that he was a celebrity doctor of his day, and he wrote books, and he believed that if we could stop little boys from masturbating, that would protect their health. And so they thought that by removing the sensitive foreskin from a child, that would inhibit that practice.
I see.
And then that's how it really got started. And then after that, doctors realized this was a nice money-making side business for them. And they came up with a host of reasons why parents had to circumcise their sons. And going forward, as more and more babies became born in hospitals and doctors took over the birth process, circumcision became the standard practice. And America became a circumcising culture, which is at odds with the rest of the world, because most of the world does not circumcise babies or adults. Like in Europe, it's like they're like over 90% intact. There's very few people.
Really? Over 90%? Yeah. Well, worldwide, it's what, 1 in 3 men are circumcised?
Yeah, roughly around there. It's principally Muslim and Jewish cultures practice circumcision. There's a few pockets around the world, maybe in tribal Africa, some parts. Some do practice circumcision, some don't for tribal reasons. But it's really a unique American practice, and it's at odds with most of the medical societies around the world.
And is it still over 50% here, I believe?
the last data we had from CDC, which is very dated in 2012, was about a 57% nationwide rate, but it's decreasing every year. So we think we're close to around the 50-50 mark.
Oh, okay, that's good. So it's on the downturn. Oh, that's long overdue, I think. Now, the awareness. A lot of people don't know. First of all, let's get into the risk-benefit ratio, which is necessary to talk about, no matter what aspect of medicine we're talking about. First of all, the health risks, like pediatricians and certain health and medical experts will say, well, it's more hygienic and you'll have less chance of infection, and there's lower rates of penile cancer and possible STD transmission, or contracting different STDs. So what is your argument there against it?
Well, first, again, I would look to the other medical societies outside of America. You look at the Canadian Pediatric Society. They do not recommend circumcision. They say the benefits do not outweigh. The risks are too great and the benefits are too slight. They don't recommend it. We even look here in America. 16 states have dropped Medicaid coverage for circumcision, calling it a cosmetic procedure and with no medical benefit. Then we go into the European medical associations like Finland, Denmark. You go to Australia. They specifically do not recommend circumcision, citing lack of any health benefits.
Interesting.
You have to say, European men, like I said, they're over 90% intact, and they have no higher rates of penile cancer. First of all, penile cancer is such a rare disease. I mean,
that's
you have a better chance of being struck by lightning. If you're really concerned about cancer, address obesity and address smoking. Right?
Yeah,
let's not cut off parts of our genitals.
But what about Anthony? What about sexually transmitted diseases? They say that they're more likely to be transmitted if in an uncircumcised male versus somebody that is circumcised.
Again, those are some of the boogeymen that the American medical societies have put out there. But when you start looking into the data, like for instance, let's talk about HPV, for instance.
Yeah, right. Human papilloma virus, yeah.
Right, which is responsible for a number of cancers. Just look at page 14 of the American Academy of Pediatrics technical report. They said the male circumcision is likely to have little impact on prevention of cervical cancer.
Really? Even them. Yeah, because the American Academy of Pediatrics, I mean, don't they... Well, what's their position on circumcision overall? Are they still in favor of it, or do they advise against it, or what is their position?
It's a good question. It's confusing. They flip-flopped on the issue several times over the last several decades. They've told people it's necessary, then they said it's not necessary. No. The last statement we have, which is already outdated, but the last thing they said is that they don't recommend it. They say there's potential benefits. Parents should have a choice, and more importantly, insurance companies should pay for it. You have to understand, the American Academy of Pediatrics is first and foremost a trade association for doctors.
Right, sure.
Okay, so they're more there to protect doctors' insurance reimbursements. We have a fee-for-service medical system. The more doctors and hospitals can bill for insurance, the more money they make. So they're more there. We believe, it's more about a money issue than a health issue.
Yeah, so often that's the case. Now, speaking of money, that was my next question, Anthony. I think, this is years, if not decades ago when I first started the show. I think it was a $200 or $300 million a year industry. Because what is it, a few $100s, or, back then it was a few $100 per procedure. What is the average cost of a circumcision now?
Costs vary widely, but those done in hospitals can be over $1,000 because the doctor gets paid his fee and then the hospital charges a facility fee. So, I've seen estimates online where they have online health cost calculators, and as the administration keeps trying to get greater transparency in what health costs are. Yeah. That's becoming a big thing, and we're seeing costs, calculated, $1,200 and up for circumcision.
Really?
So when you talk about that, there's roughly 1 million done every year. You're talking about big money, and
sure.
And then there's a whole downstream industry that takes this foreskin tissue that's been removed from babies and they use it for medical products and biotech things. So there's a demand for the tissue as well.
And the mothers, the parents don't get paid for that, right? They just, I mean, that gets donated, and then the companies are making money off the foreskins.
They're reimbursing the hospitals for their costs, whatever that is, but the parents get nothing.
Yeah.
Once tissue comes off your body in a hospital, it becomes property of the hospital.
Wow,
and
that is
shocking.
So
this stuff is ending up in cosmetic products.
Really?
So
there's cosmetic creams that have foreskin extract or something, or
absolutely. I mean, like Skin Medica is one of them. If any of your listeners want to Google like Oprah's face cream, all these anti-wrinkle creams coming on the market. So what they do is they take this infant's foreskin tissue, which they pay the hospitals for, and they culture it in labs, and they get these cells which have like stem cells and fibroblasts.
Oh, right. Yes, that's right. It's rich in the foreskin is rich in stem cells. That's right. I do remember reading that. Wow.
Fresh right off a newborn baby. And they take these growth factors and they make cosmetic products out of them. So it's.
Anthony, we need to take one last break of the hour. If you can stay with us until the next segment, I have many more questions for you. You touched on religion and culture and the perception of circumcision. And then we'll talk about female circumcision, which still occurs. A lot of people don't think it does because it's not common here in America, but in other countries, it's more common than you'd think. Also, the pain and trauma, and does the baby remember the memories of having been circumcised? And also, I want to ask you if you have any knowledge of regrowing. I know there is some research out there on regrowing foreskins for men that want to retain or regain their sensitivity that was lost from circumcision. So much more information to come here on Dr. Health Radio with my guest, Anthony Lasquadra. We'll give out his website and phone number if you want more information on this particular subject. Back after this as we continue our conversation with Anthony Lasquadra on circumcision. Anthony, you mentioned the fact that it's still common practice that circumcision is in certain parts of the world where for Muslims and Jewish cultures. Can you speak more to the religious and cultural aspects of circumcision?
Well, first of all, your listeners should understand that like virtually 98% of the circumcisions done in America are done by doctors in hospitals. So for most Americans, it's really not a religious issue.
Yeah, right.
In other parts of the world, it is a requirement for some religions. But it's really not in America. It's really a cultural thing. It's a herd mentality where someone's doing it because they were circumcised themselves, or their other siblings were, or their friends are. Their friends are doing it. It's just they're just kind of following the herd without really examining. Some people think it's necessary to do, and that couldn't be further from the truth.
Yeah. Now let's talk about the downsides or the drawbacks. You lose several inches or several square inches of highly sensitive nerve tissue. Isn't that correct?
Well, the foreskin in the adult male is as much as 15 square inches because it's a double-sided flap of skin. It has some unique features. It has what we call the 4 powers foreskin. Pleasure. There's 20,000 nerve endings in the foreskin. Protection. It protects the end of the penis. Mm-hmm. Provides its own lubrication, and it's connection. It's part of connection. Nature intended this to be on our body for a reason.
Of course,
it's in our DNA. We were meant to have it. It serves an important function.
Now, is there any benefits? I mean, any long-term consequences, I should say, to the trauma that babies undergo? And then usually, it's when you're too young to be able to do anything about it, as when you have a circumcision performed on your body. The long-term effects of the trauma, I mean, are there childhood memories that surface in other ways, or has there been any research done on that?
There's so much to speak to on the emotional harm and psychological damage from the pain and trauma done to babies during circumcision. First, let's just start off. Your listeners need to understand there's little to no anesthesia given to babies during circumcision.
That is cruel, and I just can't even comprehend that.
And people also have this misconception. It's like a quick little snip. It's a 15-minute procedure.
Really?
Wow. It takes time to do this. the foreskin has to be torn off the head of the penis. It's like removing your fingernail from your finger.
Oh my gosh, I'm so squeamish.
Because in babies, it's adhered, so they have to tear that off. They have to make an initial cut. Then they have to put this device on. They're known as either a Gomco clamp or a Mogen clamp. Basically what this thing does is it crushes the foreskin, and they need to do that to prevent the baby from bleeding out. So this device has to stay on the baby's penis for some time to get the blood to clot under the skin. Mm-hmm. This would be like getting your finger slammed shut in a car door, except we're going to keep the car door slammed shut until the bleeding stops. That's what we do to babies in America.
Oh, and it's just beyond belief.
Again, babies can't tolerate anesthesia or analgesia, as the proper term for it, like an adult can. Okay, at best, maybe they can do some local, but most doctors don't use any local because they either can't be bothered with it, babies don't complain, or they don't know how to administer it.
That is just inexcusable. I mean, that is just... There's no words to describe how bad this is. Now, since we're up against the clock, I hate to... I mean, I'd like you to expand on that, but we need to get to some other points regarding circumcision, and that is regrowing foreskin. Is there any? What's the latest research on that? I know I heard some years ago about men being able to do, having a certain amount of foreskin regrown.
Yes, there are men that perform foreskin restoration. They use various types of devices. The idea is to put gentle tension on the remaining skin and over time, the technique is called skin expansion. That's what a surgeon would do if they need to regrow some skin for reconstructive surgery, for instance. So
it's not something that you go to the surgeon for or a plastic surgeon for. You have to do it yourself.
You have to do it yourself. There's no pain involved with it, but it does take time and it takes perseverance to wear one of these devices to get the skin to grow and to cover it. And some guys do various amounts. Sometimes just a little bit is enough. Some men are uncomfortable. They have issues with erections. It could be like they had too much skin removed during circumcision. You have to realize a baby's so small, when the doctor puts that clamp device on it, they don't really know where to position it. It's kind of guesswork. They don't know how big this individual is going to grow up. But sometimes they take too much skin off.
Oh my gosh!
And so when a man grows up and matures, then he may realize that he's got some issues. So some men have used foreskin restoration to regrow some of that skin to make an erection more comfortable. Right. And then some continue to do that. It takes several years, but they can regrow enough skin to cover the whole penis.
Okay, so does sensitivity return, or do they become more sensitive after the skin is regrown?
Somewhat. There are some benefits to doing foreskin restoration. You get the gliding skin back, which is important, but the 20,000 nerve endings, those are special nerve receptors called Meissner's corpuscles, and they're in the ridged band, which is a structure in the foreskin. That can't be regrown. That is lost.
I see. Okay. Now, real quick, I got to fire off a few more questions to you because we only have a few more minutes. Female circumcision, can you spend a minute or two on that real quick?
Female circumcision, or female genital mutilation, as it's termed, it's a spectrum of things. It can be from cutting the clitoral hood, partial clitorectomy, or removal of the clitoris, to infibulation, where they sew up the entire vagina. It's a spectrum of things done. There are similarities to male circumcision in that they both claim that there's hygiene issues. They both claim that there's certain benefits to doing it, and unfortunately, in the United States, we had a federal law that was banning female circumcision or female genital mutilation. It was struck down as being unconstitutional on several grounds. So there are some states, actually, where female genital mutilation couldn't be prosecuted.
Really? Here in this country, that's shocking. Wow. Now, getting back to male circumcision, aesthetics, I think, comes into play, too, because fathers think that they want their son to look like them, right? The father-son aesthetic of circumcision. Can you speak to that for a minute?
Yeah, some fathers feel like, well, I need my son to look like me, and when I hear that, it's what I call a low-level argument, meaning like I think the father may be concerned that he doesn't want to confront what was done to him.
Yeah.
If he left his son intact, then that means that there's something wrong with him. So in order to avoid confronting that issue psychologically, he will then inflict the same thing onto his son.
Wow, that is really something. Is there a website people can go to for more information, Anthony?
Our website is intaction.org, intaction.org. And if your listeners believe that, genital cutting in all forms is something that needs to be stopped or reduced, and should want to alleviate suffering, consider coming to our website and supporting us so we can continue this important work that we do.
I thank you so much for being there and doing what you do, Anthony LaSquadro, on circumcision. Again, that website, intaction.com, INTACTION.org. I'm sorry, .org, not .com. And can I give out the phone number, Anthony?
Sure.
866, that's toll free, and then the number 6 and the word foreskin, FORESKIN. Thanks so much for being with us, Anthony. All the best.
Thank you, David.
All right.